The thing that distinguishes the Ivy Center from a lot of other brain tumor treatment centers is the Ivy Center is just about brain cancer. Typically on a first meeting with a physician, the physician will get to know the patient and their family. And the first thing we really want to do as physicians is get to know that patient as an individual, because we first want to know the patient as a person before we can do our best to take care of them as a patient. Patients who come here get a thorough evaluation and focused approach just for brain tumors, and the physician will get to know the patient and their family. They'll ask the history of the patient, what brought about the symptoms, and ask for any other details that could give them an understanding of what's going on with the patient and their other medical issues. The Ivy Center, as part of the Swedish Neuroscience Institute, is one of the highest volume neurosurgical centers in the country. And we have evidence from thousands of patient studies that show that patients who have surgery at a center with high volumes do better in the long run. And patients who go to centers that have access to clinical trials are offered the potential treatments that are not available at most places. The benefit for a patient who gets that integrated approach is they're part of a system that does this day in, day out, and they have access to the most cutting-edge clinical trials. And the clinical trials can actually make a life or death difference. It's well known that one of the biggest missing pieces of the puzzle in brain tumor treatment is addressing the psychological impact of the disease. And most places don't address the huge portion of anxiety and sometimes depression that goes along with this diagnosis. So we're very fortunate here to have Robin as a social worker and therapist who addresses these issues with all of our patients and really helps them get through some of these tough times.
When patients are diagnosed with brain tumors, it's devastating. It impacts the family as a whole, and it impacts the individual both medically, physically, and emotionally. My primary job is to make sure that the patients and families aren't alone in those tough times. And I have training in Western psychotherapy, as well as Chinese medicine, meditation, mindfulness, and animal-assisted therapy. So I'm able to integrate all of my background into the work with my patients and provide individual patient-centered care. So I'm able to empower the patients to actively be a part of their own care. If you feel that you're doing something healthy for yourself, it gives you the drive to continue to keep going and make the best of each day.
We feel that we provide the patients absolutely the best clinical care that they can get anywhere in the world for brain tumor. From the best surgical treatment to the best neuro-oncology treatment, access to clinical trials, and then access to therapy. So you will not find that really at any other center in the country.